Welcome back to Today's Health. In this segment, we're going to talk about cardiac rehab services with Dr. Vernon Dencklau, Medical Director of McLaren Port Huron's Cardiac Rehab Services. Dr. Dencklau, thank you for joining us today.
You're welcome. It's a pleasure to be here.
Now, for patients who have had a cardiac issue and are in the hospital, once they are released from the hospital, what are some of the biggest challenges that they have?
The first challenge that is the most obvious is that they need to recover from whatever event they've had, whether it's be a heart attack, anything like that, or surgery, really takes a toll on a person. They come home from the hospital weakened, fatigued, and needing to recuperate just from that. Also, a lot of the patients who've had that kind of event have predisposing issues, whether they had a lower level of activity beforehand, or other medical issues they have to also work on and are challenged to improve those things. And so you pile that on top of their recovery from the event.
So how does cardiac rehab help them to recover from that event? What is the goal of treatment?
Well, the goal in this kind of a cardiac rehab program is really primarily to, in a nutshell, enhance their lifestyle, enhance their quality of life. It does that by increasing their physical ability. And that's really our major goal.
Who could benefit from cardiac rehab services?
Well, there are a variety of patients that would benefit. The primary ones would be those who have suffered from a heart attack, with or without stent. Those patients who have had an open heart surgery, whether it be a coronary revascularization or coronary bypass or valve surgery. Then there's another subset of patients that have potential for benefit, and those would be heart failure patients, patients who have had a heart transplant or a left ventricular assist device.
Now, what are some of the benefits that a patient who's engaged in cardiac rehab services might expect to see with treatment?
The most obvious benefit is that they'd physically be able to do more. We hope that with the rehab program they would be stronger, they would have more endurance. The secondary benefits, the one we obviously are primarily interested in, is we lower their risk for further events. But the other secondary benefits can be even more meaningful to the patients. One of those is essentially just being able to do more and feel better about themselves based on their ability to do more.
What can they expect when they show up for the first time?
Well, the program is supervised by myself and an exercise physiologist with specific training in cardiac rehab. It starts with a personal evaluation so that we can take each individual patient and set for them reasonable goals, help them to assess goals for themselves. It then proceeds into an exercise program that is supervised and in a great group setting, utilizing a variety of techniques and equipment that are available. In that, they would be closely monitored in a number of parameters, things like blood oxygen level, heart rate, blood pressure, sometimes blood sugar would all be monitored closely. And all this would be done in very close communication with the physician that's taking care of these conditions.
So the patient can feel assured that they're building their stamina, exercising while they're still being monitored to make sure that they're okay.
It's a safe way to enhance their ability to do things.
Now, for our viewers who might be interested in this type of program, how do they get more information? Do they need to be referred?
They'll need a referral or prescription from their physician, whether it be their family physician, cardiologist, or cardiac surgeon.
Dr. Dencklau, this has been great information. Do you have any closing comments?
I simply would like to encourage patients who've either had an event or even those who are at risk for having an event to take a very strong look at the issues that might get them into another cardiac event, whether it be lifestyle issues such as cigarette smoking or a sedentary lifestyle, other risk factors like obesity, high blood pressure, and diabetes. And don't delay. Attend to them. Don't wait until after the event.
Doctor, thank you for joining us today.
Thank you for having me.
Stay with us. We'll be back after this message.